Hi everyone, Dinesh Sirasena here, and today we're going to be talking about imaging the adductor tendons of the hip. As with my previous videos, I recommend two resources. Firstly, the ESSR guidelines on musculoskeletal imaging, and in particular the hip joint, and secondly, ultrasoundcases.info. So here are the images from the ESSR guidelines for scanning the hip joint. As you can see, the patient is positioned in a supine orientation with the inner aspect of the thigh exposed. When scanning this area, you will see the adductor muscles, which then blend into the adductor tendons. The order of the adductor muscles are the adductor longus, the adductor brevis, and then finally the adductor magnus. In practice, when scanning the patient, I tend to have them in a supine position with one leg crossed over the other. This exposes the adductor region of the hip, and if you want to have a bit more stability, you can roll a towel and place it under the ipsilateral knee. Depending on the body habitus, you may want to extend the hips a little bit more, and you can achieve this by dropping the end of the bed a little bit lower. This tends to be much more comfortable for the patient, and it tends to allow for much more stable imaging. In practice, I tend to use a linear transducer. Ideally, you should pick one which enables a good penetration of the tissue, such as one that has a lower frequency. When scanning this area, again you will see the adductor tendon attaching onto the pubic symphysis. You will see the tendon of the adductor longus, beneath which will be the adductor longus muscle. Beneath this is the adductor brevis, and then the adductor magnus. It's also useful to evaluate these muscles in a short axis orientation. Here's an image from ultrasoundcases.info which demonstrates adductor tendinopathy. In this, you can see there's loss of the normal fibrillar architecture of the tendon and some calcific changes within the body of the tendon as well. Thanks for watching. I hope you found the video informative and it adds to your knowledge of musculoskeletal ultrasound imaging. If you did, please remember to hit the like down below and subscribe to the channel for further updates. You can also follow me on Twitter and Instagram, and remember to check out sportsmedinfo.sg. Thanks again, and I hope to see you all very soon.